Coming up on Open for Business, we talk to Kaiser Permanente about the Thriving Schools program. Today on Open for Business, we're highlighting the Thriving Schools program by Kaiser Permanente. The program's goal is to help meet the unique health needs of schools and their surrounding communities. Here today to provide more insight about the program are Stephanie Kirk and Laura Howard from Kaiser Permanente. As an additional layer of outreach, we've added a QR code that you will see on the screen periodically. This code can be scanned and you can ask questions and give feedback to the show's guests. With that being said, welcome Laura and Stephanie. Thank you for being here.
Thank you, Louis.
I'm really excited to talk about this specific topic because as a former teacher and as a person who is in the community regularly, I'm really excited about what I've heard about Thriving Schools. So first, tell me, what is Kaiser Permanente, and give me some more information about Thriving Schools.
Well, thank you for allowing us to be here. Kaiser Permanente is a nationwide healthcare organization that is non-for-profit. It's in 8 states in the District of Columbia, and it has over 12 million members. Regionally, we have over 35 medical facilities where you can receive care. So that's your primary care, your specialty care, maternal health, pharmacy, and labs to get all of your specific healthcare needs met. And then we also have our community program. When Henry Kaiser and Dr. Sidney Garfield created Kaiser in 1945, their vision was to have a workplace healthcare model. And that's how Kaiser's integrated care model was born. And we couple that with our community health aspects that improves our communities and prevention.
And so community health, which is the department I work in, is a national initiative to really address the social determinants of health that really affect health and wellness for everybody. As I'm sure you know, when you go into a medical office, that doesn't make you sick. It's what you encounter every single day. That's where illness comes. And that's actually what Kaiser is really founded upon. So one of my favorite stories about Dr. Sidney Garfield was that back in the 40s in the shipyards with Henry J. Kaiser, he was hired to provide treatment to the employees who were working in the shipyards. And he actually instituted the prepayer model so that rather than people having to pay a high amount when they come in, they could pay a smaller amount on a regular basis and then be able to get regular care. But what I find really fascinating is that Dr. Garfield, he started noticing that there were similar issues and people kept coming into his office with holes in their feet, different problems with holes in their feet. And so he did what seemed simple, but it actually was very innovative. So he actually went to the shipyards and he investigated the area to find what was causing the holes. And he found that there was a section that had nails all over it. And so instituted a policy to, pick up all the nails and make sure that it was safe. And so it was that sort of proactive looking at what it is in the environment that's actually affecting health. And then what can you do about it to really prevent chronic illness? And so when we look at how we can do that in the community, schools are the ideal place where you can do that sort of proactive upstream health and wellness. And that's why we have started Thriving Schools. And Thriving Schools really is it's an initiative, it's a program, it's multiple programs, but it is designed to really support overarching health and wellness for teachers, students, and staff.
Just the layers of watching the evolution of the founders and the leaders in the organization from its inception, you think about they were paying attention and trying to find the causes of the things that ailed the people that they were connected with. But it led them to connect to more people. And so I think about that because what you're doing with the Thriving Schools is you're intentionally connecting with more people. And so as you think about that, what are some of the results that have stood out to you based on like what your work has been?
Well, I'll speak to a few of our programs. In addition to the medical needs of the staff, teachers, and students that we take care of, we look at how can we be good pillars in the community. So we partner with different organizations, one of them being the Maryland Business Roundtable for Education. And recently we hosted an industry day, and we had over 50 students, including Anne Arundel Public School students, come to our medical center in Lutherville Timonium and spent a whole afternoon doing tours, speaking to physicians, and just learning about all the different avenues that you could pursue in healthcare. And we believe that when you start to give them that exposure early, they can start to envision who they may be if they want to pursue the healthcare field. We have other programs, a student internship in the summer. We actually have another partnership with the Maryland Chamber of Commerce where we host a teacher as an extern in the summer, and they learn all about our facility, and then they take that knowledge back to their students. So we have a number of ways that we directly impact our students through our medical center and also through our resources.
Yeah. And in addition to that, we also put a huge amount of time and energy into how we can address the policy system and environment in schools and districts, do it at scale. So we look at things like what I call the three-tiered school: physical, mental, and social health needs for everybody. So physical needs would be immunizations. Mental health, obviously, is such a huge priority. And then social health needs would be looking at, housing, clothing, food. Do the students that are high need or low income have the resources that they need in order to be able to be successful? And so you asked about what we'd consider some of our big successes. I'd say one of our biggest successes is what we call the SIA. The T is silent. It's the Thriving Schools Integrated Assessment Tool. And so it was an assessment that we created in partnership with the Alliance for a Healthier Generation. And the idea is that it looks at all of those areas of health. It looks at the physical, the mental, and the social health. 14 different areas to be exact. And it allows at the district level and also at the individual school level to be able to zero in and answer questions relative to that particular health topic. And an example of a health topic would be staff wellness. Is something that we put a lot of resources towards, because we know if you don't have healthy staff, you're not going to have healthy kids. And so making sure that staffs have all the resources they need for mental health, whether it's education, whether it's creating staff wellness rooms for them, or you name it. I mean, we really prize ourselves on it. But then going back to the SIA, with that, the idea that you can use the information to get an unbiased and evidence-based look at what the needs are for your school or for your district, what improvements you can make that will actually make a marked improvement. And then you can put together an action plan with support from us and support from the Alliance for a Healthier Generation that will help you move it to the next level. And then you can go in year after year and you can see your progress and see where you've made these measurable changes. So things like policy changes around attendance, or program changes and allowing for school nurses. Things, it really depends on what the needs are. And then this tool that is a national tool, it's a free resource, it's available to anybody, that has really made a huge impact.
Well, and I think you both kind of alluded to it because you mentioned Anne Arundel County School students, and you mentioned the SIA tool. And so my next question is kind of connected to, so thriving schools, we see what it looks like on sort of a big overarching thing.
Mm-hmm.
But in Anne Arundel County schools, all school districts are different. And so because you've had some interaction with them and you have a tool that helps you, what are some things that you would see that are specific for Anne Arundel County that would, support the mission here?
So So with the SIA, we've actually been working with Anne Arundel County to complete a section of the SIA. And the plan is that we hope to provide a grant to the county to implement whatever it is. It's still a little early in the process. So we can't give too much information about that, but we're really excited that we're going to be able to support that. I believe I can say it's for teacher and staff wellness. Um, we also, have lots of opportunity to look at attendance. That's a big area that we're starting to do a lot of focus on and develop resources on, and would love to be able to support the county on different measures to address attendance. It really we're kind of just getting started. It's sort of new, and we really have developed our resources to be responsive to the needs of the school district. So it's kind of the sky's the limit at this point. We really will see, I think, at the end of the year more about all the great things that we've done, but we're so excited to be able to really roll up our sleeves, identify what the needs are with the school district, and then provide support and resources as needed.
Okay.
And I would add that although Anne Arundel Public Schools is not a current account of Kaiser Permanente, we still are committed to improving the health of all of our communities. So members and non-members are access to all of these resources. And as we develop the relationships, understand the needs, have more planning sessions, and maybe be integrated into the school more, we can use all of our resources. So we have our physicians, we have our workforce health program. They do a lot of things around mindfulness, resilience, managing stress. During the COVID epidemic, we had virtual online dance parties just to boost the morale. So we had teachers from across all of Maryland participate in those, and it's responding to the needs of that current time and the strategy of the school district. So we're excited to continue the partnership and see where we can plug in and provide resources.
And it sounds like you have a plan where you probably have one or two things specifically that you think would connect really well in our district. But I want to ask more specifically about something that is a little bit apart from that, is that this program is very expansive. So what are some things that people might be surprised that comes from the Thriving School programs?
I think surprised to learn that comes from the Thriving Schools program. So I'd say that the connections between health and different things, I think when most people think about school health, they think about school nurses, they think about immunizations. And I think people would be surprised to know that we really are taking that holistic look and supporting. Mental health, but really social health. So community schools is an area that I know I'm personally very passionate about. And how can we support community schools? I'll give an example of a program we did with Prince George's County. We have a tool that's called Thrive Local, and it allows a provider to do a bidirectional referral for social services. And we started it using that tool for our Medicaid population, but we actually realized that schools in Prince George's County, their community schools, their community school coordinators were saying, we're really struggling with trying to find resources for our students. I'm like, well, why don't you utilize this web tool? So we negotiated and we were able to get that put in several of the community schools. So I think going back to Stephanie's point of we really try to bring all of our resources together. I think the other surprising thing about what we do is that it isn't just a program in a box. I think where we really excel is we like to think creatively with all of the resources that we have. So if there's a need for a physician to provide, speaking, if there's a need for one of our big programs is that we like to match our medical centers with schools so that they can have a school partnership and do, volunteer drives and things like that. Or if it's policy support, if it's food access and food pantries in schools. It really is looking at the entire list of everything that really affects health and wellness. And again, particularly, I think about teachers and staff. I think a lot of organizations either focus on students or they focus on teachers and staff. I think we're one of the few that really focus on both and put just as much, if not more, effort into providing as much support as possible for teachers and staff.
And Laura, I'm really proud of the work that we do around prevention. I think when people think of medical care, they think of acute care instances or going to the doctor, but the community health mission vision is throughout our whole organization. So when we think about how we treat our members, it's all around how can we keep you healthy, because that's what our model is about. So if you are a Kaiser member, I was actually surprised to know that your life expectancy is 6 years longer in this region. And that's really due to the way that we treat patients. So when you come into a medical center, for example, and I had this happen to me recently, I went in for an eye exam and they say, oh, I see that you haven't had this other test for a whole nother specialty updated. So let's get you in to make sure that that's in line. And so many times you hear stories of people saying, oh, I found out that I need to have a mammogram. And because of that, I had early detection. Or because I went in for something else, I was able to manage my chronic illness better. And so we're seeing those results. And we know that if you have healthy staff, healthy teachers, they can provide better education to our students. So how we can keep people in the classroom and living their most productive, healthy lives is really the cornerstone to that work-based care that we talked about from the vision originally discussed.
It's so exciting to hear about the things that you've done and that you're planning to do. And to support that, we're going to do this in a segment. So this is just the beginning of what we plan on doing. And so we plan on chronicling your work as we go.
Wonderful.
And so with that, when we come back to do a second episode with you, what are some things that you think you can anticipate or hope that are implemented as we meet again in the end?
So I know one thing that I anticipate is that we will have completed our grant, and so we'll be able to talk more about that implementation. That again, I believe is going to be towards the staff wellness, but I can't talk about it totally just yet. I hope that we plan on having, we had a school summit earlier this year, back in August, where we brought in educators from across the DMV, including Anne Arundel County, for a day of talking about some of the major health issues. So we talked about social media in youth, we talked about school safety, and talked about also teacher and staff wellness. So would love to do that again. We're planning to do that again in April. And then also we've developed a national initiative, like I said, around attendance, where we can bring in experts and really dive deep with school districts and leaders in school health to talk about what are the issues that are affecting attendance, since we know that attendance really is one of the prime indicators of success, and that health so much influences attendance. So knowing that a lot of our work can really impact and improve attendance. So we would love to have a convening with the county, multiple counties even, and really roll up sleeves and say, how can we support you on attendance? What are the needs? How can we help convene with other districts so we can create those support networks? And then what are the resources that we have that can really support it as well? So those are just a couple things. I also hope that we have partner schools by the end of the year for our Annapolis Medical Center
And North Anne Arundel.
and North Anne Arundel, and just, again, whatever the district prioritizes, we really hope that we can provide it. So more to come.
That's really exciting because to seeing the execution part is going to be really exciting, because then it's about, well, what can we do next? So as we close out, there's a lot that was unpacked today, and so I would ask you to let us know where is the best place to find information about Thriving Schools, and who are the best points of contact for the Thriving Schools program with Kaiser Permanente.
So I'll start with general information about Kaiser Permanente. KP.org is your resource for all things related to your healthcare needs, resources, and a diving off point to other topics.
And then we have the National Thriving Schools website. We'll have it up on the screen. That is our national website that has a huge amount of resources and information about thriving schools. And then if you want to reach out locally, I will offer myself up as the lead for Thriving Schools, and you can email me at laura.j.howard@kp.org.
Ladies, it's been wonderful to learn about this, to talk about this, and to plan about what we're going to do when we revisit. So thank you so much. So thank you for your time. And as a reminder, scan the QR code you've seen this episode to ask questions or to give feedback. And again, thank you for watching Open for Business.